Okay, guys. So today I'm going to tell you an incredibly easy way to remember the germ cell tumors and the non-germ cells tumors for step one. So the germ cell tumors in men are, I'm sorry, are like of five types. You got the seminoma, the embryonal carcinoma, the yolk sac tumor, the teratoma, and the choriocarcinoma. So now remembering the characteristics for them was very hard for me. So now I made some mnemonics and the important key points I have entailed here. So seminoma is malignant, painless, homogeneous. It is the most common tumor in men, is analogous to ovarian dysgerminoma in the females. It is not present in infants. It has a fried egg appearance in a watery cytoplasm. It presents with increased level of pleb, and it is radiosensitive and has an excellent prognosis. So right now I have this picture, and this only has adults to emphasize that it is not present in children. So first we have this picture of a salmon right here, and this salmon indicates that it's a seminoma from salminoma, so like that. Now you see a woman, and the woman is happy. She is wearing a dress that kind of looks like the flag of Germany, so that emphasizes the dysgerminoma, that is analogous to the ovarian dysgerminoma. Then you can see that she is cooking an egg in water, so that represents the histology, that it has a fried egg appearance in a watery cytoplasm. Then we see that she is happy because she is listening to a radio. So she is listening to the radio. Now this emphasizes that it is radio sensitive. Now over here we see a man who is yelling at her, and his hair is turning red with anger. So that means that this is a very malignant tumor. And just for basic knowledge, all the tumors that are from germ cell, that arise from germ cell, all of them are malignant, except for one distinction that I will tell you later. Now behind the man is a flag of UK, and I drew that to emphasize PLAB, which is the licensing exam for UK, for medicine in UK, but it is nailed high to the wall, so that increases that it has a high level of PLAB in a seminoma. Okay, so that's basically it. And you see that the woman is smiling, so that means that it is painless. Okay, so that was seminoma. Now we have the embryonal carcinoma, and embryonal carcinoma is malignant, painful. It has on histology hemorrhagia and necrosis, and a glandular and papillary histology. It is most commonly mixed, but it can also be pure, and it presents with metastasis. It has an increased HCG level, and if your embryonal carcinoma is pure, you will have a normal AFP level, but if you have a mixed embryonal carcinoma, you will have an increased AFP level, and it has a worse prognosis than our seminoma, which had an excellent prognosis. So here is a story of a kid named Embry for embryonal carcinoma. So you see that Embry is crying and holding up a finger, and it is red. This is to emphasize that it is painful, and we have highlighted this in red to emphasize that it is malignant. Now why is Embry crying? Well, you can see that he has accidentally hit something, and he fell down, and in doing so he spilled the bottles of colors of black paint and red paint. So the black represents necrosis and the red represents the hemorrhagia. And you can also see that a bottle of glitter has also spilled, so that emphasizes the glandular appearance. And the finger that he is holding up emphasizes the papillary appearance on the histology. Okay, so now we see that it is written here CGH. CGH means in this picture children group H, but you can see that it is pinned high on the wall, so that means that it has an increased level of HCG. CGH, HCG, high level of HCG. Now why did Embry fall down? You can see here that he accidentally tripped over an orange. Now here you can see that there are two platters. In one platter you have oranges, and in one platter you have apples and oranges. The one with the oranges, which only has oranges, is down on the floor, so that means that it has a normal level of AFP or a fruit platter. But you see that the one which has mixed both apples and oranges is settled high on the shelf, so that means it has a high level of AFP. Just like we have said that a pure embryonal carcinoma will have a normal AFP and a mixed embryonal carcinoma will have an increased AFP. So those are all of the characteristics of an embryonal carcinoma. Next we have a teratoma, and teratoma is very easy. You only have to remember that it is malignant in adult males, while it is benign in females and children. So you see that the man is having a very angry head, it is malignant, and the female is happy and the child is happy. So it means it is benign in the female and the children and malignant in the male. M for malignant, M for male. Okay, now we have the last one, the second last one, is yolk sac. I didn't draw it because it's kind of very easy to remember, only that it is malignant like all of the germ cell tumors are. It is aggressive. It is analogous to ovarian yolk sac, which is very easy to remember since it already has yolk sac in its name. It has Schwarr dual bodies which resemble glomeruli. It presents with a high level of AFP, and it is most commonly present in children less than 3 years old. So you can just imagine a child eating an egg, and that will basically be it, the most high yield points regarding yolk sac tumor. Now we have the choriocarcinoma, and the choriocarcinoma has the following characteristic. It is malignant. It is composed of disarranged syncytiotrophoblasts and cytotrophoblast. It presents with metastasis to lung and the brain. It presents with a high HCG level. It presents with gynecomastia and also can present with hyperthyroidism. So here we see that there is a glass of milk, and next to milk are a stack of Oreo cookies. So Choreo comes with Oreo to remember this image. Now you see that the child is picking up a sign and wearing goggles and also has a bow tie. So the sign here represents syncytiotrophoblasts, syncytio, so sign for syncytio, and he is holding a sign, and he is holding goggles for sight for cyto. So they have a disarranged arrangement of cytotrophoblast and syncytiotrophoblasts. Now he is also holding a bow tie, wearing a bow tie which represents what? Hyperthyroidism. Look at where he is wearing it, on his neck. Okay, so while he is looking away, another kid comes and he is picking up an Oreo and eating it. You can see that he has a very strange hairstyle, and he also has goggles which he is currently not wearing. So the location of the goggles and the hairstyle represent metastasis to brain and lungs, and the strangely inappropriate position of the goggles also present gynecomastia in children. It can also present with gynecomastia. So these were all of the 4 germ cell tumors in male. Now the non-germ cell tumors are only 3. and where basically the Leydig cell tumor, the primary testicular lymphoma, and the Sertoli tumor. Now the Leydig tumor is actually very easy to remember. You just have to remember this man. You can see how he has a very tan golden brown skin, so that represent that on histology it is mostly golden brown. Now you can see that he also has the goggles which are inappropriately placed, and it also represents gynecomastia, that it can also present with gynecomastia. You can see that he was recently digging the ground and he found a crystal. So digging the ground, Leydig, and holding the crystal represent the Ranke crystal, which are eosinophilic inclusions which are found on the histology. And the hard signs on his eyes, which here are there because of seeing the crystal, are actually representing precocious puberty, which could be seen in Leydig cell tumors. Sertoli, the only thing that you need to remember about Sertoli is that it is benign. It is the only tumor which is benign, and it's a non-germ cell tumor. Other than that, the only condition in which there was a benign tumor was when there was a girl and a boy in the females and the children in a teratoma. The last tumor is the non-germ cell tumor, is the primary testicular lymphoma, and you only have to remember that it presents in older than 60-year-old males. It is malignant, and it presents bilaterally, most commonly due to diffuse large B cell lymphoma. So here there are 2 large black stones, and the man is angry that they are blocking his path. So I hope you enjoyed this video. This was all the germ cell tumor and the non-germ cell tumors. And if you guys have any questions, you guys can ask, and any comments, I'll appreciate them, and thank you.